So I was on call last night and we had a 9-year-old girl who came in for emergent surgery. She was unfortunately somebody who had been to the hospital multiple times and had multiple surgeries. And so she was very familiar with how the operating room system worked. And, she was very inquisitive about asking people like, who are you? Who are you? She seemed rather comfortable in the hospital type setting. Anyways, we bring her back to the operating room. Everything is, happy dandy. And after we check the patient in and we get ready to induce anesthesia, my attending had tried to flush about 2 to 3 cc's of normal saline through the IV to test it out to see if it worked. At that point, she had a 22 gauge in her AC in a cubital vein, and she started screaming immediately. So whatever that saline flush was doing to her IV was very painful, probably because it had infiltrated or it wasn't in the right spot. So quickly had to change plans. Our plans was to induce general anesthesia using that IV. But once she started screaming, so it was totally, a big shift in her demeanor. Started screaming, asking for her parents, wanting to get out of the operating room. Luckily, we had some hands nearby to kind of hold her down, make sure she didn't fall off the operating room table. And so what I did standing at the airway was I turned the SIVO all the way up to 8%. I turned on some nitrous oxide, and we ended up doing a mask induction, which is typically what we do for kids for elective surgeries who don't have IVs beforehand. So the way this works is you have all this anesthesia gas coming through the oxygen mask now. And so my job is to basically hold that mask over this girl's face. And as she's crying, she's sort of breathing in this anesthesia gas, and all it really takes is about 2 to 3 big breaths of anesthesia to knock her out. Once she's knocked out, we place another IV in her opposite arm, end up taking out the old IV so nobody uses it by accident, and everything turned out to be fine. But this is a scenario where there's 2 big learning points. One, you want to test your IVs prior to using them for induction, especially if you're not the one who placed the IVs, because you never know if they're infiltrated or if they're working. You can figure that out pretty quickly by just flushing a few cc's of normal saline to see how much resistance you meet. Number 2, there's a couple different ways you can induce general anesthesia. For most adults who have IVs, we'll use propofol and do an IV induction. But for kids, or even for certain adults who have like mental disabilities like Down syndrome who wouldn't cooperate for an IV, you can always use an inhaled anesthetic to use a mask induction and get them off to sleep. And then you also have the benefit of vasodilation. Their veins get a little bit bigger. So starting an IV after you've induced with some anesthesia gas, it's actually a little bit easier. So a couple takeaways.